Today let's talk about veins of head and neck. So I'm making the skull, like the face part. Okay. So this is supratrochlear vein, this is supraorbital vein. Okay, these two combine to form angular vein. Okay, so this is supratrochlear, this is supraorbital, and it is combined to form the angular vein. Okay, then it comes down. From this nose side, there attaches the lateral nasal vein. Okay, then in the angular vein attaches combines the lateral nasal vein. From here, when it comes down, this is lip, upper lip. So here comes the superior labial vein, and from here comes the inferior labial vein. And then it comes and it descends down, and this is now known as the facial vein. Okay. So the supratrochlear vein, the supraorbital vein comes down as an angular vein. Then in the angular vein there comes the lateral nasal vein. So then comes the superior labial, inferior labial. These are the facial veins. Okay, so this altogether forms the facial vein. Then this is the temporal area. So from here comes the superficial temporal vein, and this is superficial temporal vein. And from here, this is the maxillary area. From here comes the maxillary vein, and these two combine to form retromandibular vein. So as it is like this is the mandible, so it is behind the mandible, so it is known as retromandibular vein. This is the maxillary vein, the superficial temporal vein come into retromandibular vein. Then retromandibular vein divides into anterior branch and posterior branch. This is the ear. Okay, this is the auricle. From behind of the auricle there comes the posterior auricular vein. Here comes the posterior auricular vein. It comes and then it joins the posterior part of the retromandibular vein. This is the posterior auricular vein. So there's a kind of mnemonic. This is the posterior auricular vein and this is the posterior retromandibular vein. So those who are posterior, that is those who are behind, they are out of the game, and those who are anterior or those who are together, they are inside the game. So this is posterior, these two are posterior, so they will drain into external jugular vein. Okay, so this is posterior, so they will remain behind, so they will be out of the game, so it will be draining into external jugular vein. Okay, now this facial vein, this is the anterior part. These two will combine and they will drain into common facial vein. They will form common facial vein, and this common facial vein then will drain into internal jugular vein. Why internal jugular vein? Because it's common, means they are together, so they will be in the game. So in the game, that is internal jugular vein. Okay, external jugular vein will drain into subclavian vein. This you have to remember. I didn't find any mnemonic. So external jugular vein will drain into subclavian vein. Then eventually these two, subclavian vein and internal jugular vein, so these two will form drain into brachiocephalic vein. And eventually brachiocephalic vein will drain into our superior vena cava. So let's take a quick revision from the eye, from upper side. If we talk about from the scalp or some upper side, above the eye, obviously there is a trochlear region, so there will be coming the supratrochlear vein, and this is orbital region, so there will be supraorbital vein. So they will combine to form angular vein, as it is the angle. And then from the nose will come lateral nasal vein, from the superior lip will come superior labial, from inferior lip inferior labial, and these three, lateral nasal, superior labial and inferior labial, these three branches will join the angular vein and form the facial vein. And then this forms the facial vein. And then here, this is the temporal region. From here the superficial temporal vein will come, Okay, so that's superficial vein. So superficial temporal vein, this part is maxilla, so there will be maxillary vein. This will come down and form the retromandibular vein, because this is mandible and behind it it's retromandibular vein. Then forms the posterior division and anterior division. Okay, this till here. Then this is the ear. This is behind the ear is posterior auricular vein. Then the posterior auricular vein comes and joins the posterior part of the retromandibular vein. These two are posterior, so it will be out of the game. So it will drain into the external jugular vein. External jugular vein, and it will drain into the subclavian vein. This anterior division of the retromandibular vein and this facial vein will drain into common facial. When you are together, when you are common, then it will drain into the internal jugular vein. Okay, then internal and subclavian will form brachiocephalic vein and eventually into the superior vena cava. So, and this medial side of the nose and this lips and upper and lower lips and eyes. Okay, so this area is known as a dangerous area. Why it is known as the dangerous area of the face? Because from here they are mainly, if you are seeing directly, then superior ophthalmic vein and inferior ophthalmic vein. These veins which drain this area go to the, here there is cavernous sinus. Okay, so these veins go into the cavernous sinus. Okay, so if there is any kind of infection in this area, suppose you have any kind of pimple or something in this area and you are pricking it, and this may cause an infection in this area, that's why you are prescribed not to prick. So there will be infection. This infection through the superior ophthalmic or inferior ophthalmic can go to the cavernous sinus through superior orbital fissure. Okay, so it will go to the cavernous sinus and it may cause cavernous sinus thrombosis, which is a dangerous condition. So this was about veins. Thank you.